Nature is amazing, isn't it? The fresh air, the sounds of birds, the crunch of leaves underfoot. It's the perfect escape. But while you're out enjoying the wild, something tiny might be planning its next move. On you. Yup, ticks. Small, sneaky, and kinda gross, but also surprisingly fascinating. Today, we're talking about what happens when a tick bites you, how to handle it, and how to protect yourself and your pets from becoming their next snack. You come home after a great day outdoors. You kick off your shoes, relax, maybe throw on a movie. Then, itch! You reach down to scratch your leg and feel something strange. A little bump. Not quite a mole. Not a scab either. You take a closer look, and there it is. Tiny, round, with legs. Clinging to your skin. A tick. Ticks are arachnids, which means they're related to spiders and scorpions. There are hundreds of species, but most of us will only encounter a handful, like the black-legged tick, dog tick, or lone star tick. Some are so small they look like a speck of dirt. Others are big enough to notice, but only after they've started feeding. They don't fly or jump, they wait, usually in tall grass or brush, holding their front legs out like little grappling hooks, ready to grab on as you or your pet pass by. Once a tick finds skin, it uses tiny saw-like mouthparts to cut in. Then it inserts a feeding tube and starts drinking blood. Their saliva numbs the area and contains chemicals to prevent clotting, so you might not even notice. Some ticks feed for just a few hours. Others, days. And all the while, if the tick is carrying bacteria or viruses, it might be passing those into your bloodstream. Now, not every tick carries disease, but the ones that do can cause some serious health problems. The most well-known? Lyme disease. But there's also Rocky Mountain spotted fever, ehrlichiosis, babesiosis, and more. Symptoms can show up days or weeks after the bite. You might feel like you have the flu. You could get a rash, sometimes that bullseye shape people associate with Lyme, or red spots on your wrists and ankles with spotted fever. If you're not paying attention, tick-borne illnesses can go untreated, and in rare cases, they can even be deadly. Found a tick? Don't panic. But don't get creative either. Forget matches, nail polish remover, or Vaseline. Those old tricks? Not safe. Here's what to do. Find tip tweezers. Grab the tick as close to the skin as possible. Pull upward with steady, even pressure. Don't twist, don't yank. As it's out, clean the area and your hands with soap and water. Disinfect the bite with rubbing alcohol. If part of the tick's mouth breaks off and stays under your skin, don't worry, your body will usually push it out like a splinter. After a bite, monitor your health. Watch for fever, chills, headache, but you forgive, muscle or joint pain. Rot-is. If anything feels off, even weeks later, talk to a doctor. Mention the tick bite. Early treatment with antibiotics can make a big difference. The best way to stay safe? Avoid bites altogether. Wear long sleeves and pants. Tuck your pants into your socks. Use repellents with DEET or picaridin. Stick to the center of trails. Avoid tall grass and brush. 2 outdoor activities. Check yourself. Scalp. Behind armpits. Waistband. Behind knees. Ankle. Between your toes. And don't forget your pets. Dogs and cats can bring ticks indoors too. Quick trivia before we wrap up. There are nearly 900 species of ticks worldwide. About 90 of them are found in the continental US. Some ticks are so tiny they can fit through the holes of your sock. So, what happens if a tick bites you? You might be fine, but you might not. That's why awareness, proper removal, and prevention are so important. Enjoy nature, hike the trails, go camping. Just don't forget that the smallest things out there can cause the biggest problems. If you're not prepared,